Hello, everybody. I'm Hilary Shager. I'm the Associate Director of Programs and Management at the Institute for Research on Poverty, and I want to welcome everyone to our weekly virtual seminar. I'm subbing in for our director, Catherine Magnuson, who regretfully couldn't be here today because she's giving her talk herself at this same moment, but she sends her regrets. And today we're very excited to have Beth Shinn, the Cornelius Vanderbilt Chair and Professor in the Department of Human and Organizational Development at Vanderbilt University. She's here to discuss In the Midst of Plenty, Homelessness and What to Do About It. I want to mention that today's seminar is co-sponsored by the University Alliance, and we're very thankful for their partnership on this, and you can learn more about them at their website. And also, just a quick reminder to please type your questions in the Q&A box. Beth had said she is willing to take questions throughout, although we'll kind of monitor for time on that. And I will be monitoring the Q&A box. So again, please try to get them into the Q&A, not the chat, and I'll try to monitor that carefully. And without further ado, I'd say let's jump into Beth's presentation. Thank you, Beth.
Oh, thank you so much. And it's a pleasure to join you here today, albeit virtually, to talk about homelessness and what to do about it. My central message is that research shows us how to end homelessness, and we as a country have the resources to do it. So I'm going to address 4 questions here. Who becomes homeless? Why? How do we end homelessness? And how do we prevent it? We have the most evidence for the kinds of homelessness tracked by the Department of Housing and Urban Development. That is, people who are in homeless shelters like the one pictured, and people who are completely unsheltered. So who becomes homeless? Over 500,000 people are staying in shelters and transitional housing programs, or are found in street counts on a single night in January, and we know that we miss people. The Department of Housing and Urban Development counts these 2 groups, sometimes called literally homeless, because their focus is getting housing services to the people who are worst off. But many more people experience homelessness over longer periods, and by different definitions. Over the course of a year, over 1.4 million people stay in shelters. 500,000 of them do so as part of families, with at least 1 adult and 1 child. The Department of Education has a broader definition because their focus is getting educational services to school children. DOE includes children and families staying in hotels or doubled up with other households in the same dwelling unit. Schools report that 1.5 million school-age children are homeless over the course of a year by this definition. Again, we suspect that children are missed because families may not notify schools when they experience homelessness. It turns out that the way to get the largest estimates of homelessness is with telephone surveys. Back in 1990, early in the current epidemic of homelessness, a telephone survey of people living in regular housing, no homeless shelters or barracks or jails, found that 7% of adults said that they had been literally homeless at some point in their lives, and twice that many if we count doubling up. So most homelessness is a temporary state that people pass through. That gives us many points of intervention. How do we prevent homelessness? How do we help people escape it? How do we stop generating more? By HUD's reckoning on a single night, there are roughly equal numbers of individuals without children who are sheltered, individuals who are unsheltered, and families, most of whom, thankfully, are sheltered. Some of the individuals are parents who've been separated from minor children. By the Department of Education reckoning, 3/4 of homeless students are doubled up. 12% are in shelters, transitional housing, or awaiting foster care, and 7% each are unsheltered or in hotels. The numbers by these 2 systems of reckoning are not fully compatible, even where they presumably overlap. Both agree that a relatively small, although particularly troubling portion, are unaccompanied children, who may be in any of the other categories. The people who are captured by the 2 definitions of homelessness are not that different. Over half of people who become literally homeless are leaving doubled up situations, as opposed to 1 in 6 who leave a place that they owned or rented, a place from which they could be evicted. And in a national study, I will tell you about later, that followed families recruited in homeless shelters over time, 3/10 of families who received the usual services available in their communities were doubled up 3 years later. Most research about preventing and ending homelessness uses the HUD definition, so I will focus there. But the findings probably apply to people who are doubled up as well. Estimates of the number of people who were homeless on a single night decreased somewhat from 2007 to 2016, and then began to creep up again because of a rise in people who are not sheltered. That relative stasis might lead you to think that there's nothing much we could do about homelessness. I'll try to convince you that conclusion is wrong. Research shows us how to end homelessness. Now let's look at some additional characteristics of people who become homeless. Infancy is the age at which an American is most likely to stay in a homeless shelter. Children are a blessing, but require food and special furnishings, and they outgrow their clothes every time you turn around. Most importantly, they require the parent either to pay for costly care or to stay home to provide that care. Rates of shelter use stay high in the preschool years and drop when children reach school age and childcare expenses drop. Homelessness rises again in early adulthood when some of those young adults become parents. So when we think about the face of homelessness in America, we should think not just about the man on the left, but about the child on the right. There's one more important thing to know about people who become homeless. People who face racism and other forms of social exclusion are particularly vulnerable. African Americans and Native Americans have disproportionately high rates of homelessness, even among people who are poor. Other forms of social exclusion, including exclusion of people with disabilities, also matter. And LGBTQ youth are more likely to become homeless than heterosexual youth, largely because of exclusion by their families. But even among people with disabilities and among LGBTQ youth, African Americans and Native Americans are at special risk. Now let's talk about the causes of homelessness. We have 3 powerful pieces of evidence that what caused the current epidemic of homelessness is a housing affordability crisis. What I mean by the current epidemic is the homelessness that began to be apparent in the early 1980s and continues today. One piece of evidence comes from history, what was going on when the current epidemic of homelessness started. Another piece of evidence is from geography, where rates of homelessness are highest. The third piece of evidence is from what we know prevents homelessness. This slide shows that in 1970, there was a small surplus in the number of housing units that people at the bottom of the income distribution could afford, by the standard that households should spend no more than 30% of their income on rent. And we had very little homelessness. That may be hard to imagine. Young people today have had to pick their way around their fellow citizens on the street throughout their lives, and older people can scarcely recapture their shocked disbelief at the rise in homelessness. Indeed, in the 1960s, social scientists thought that homelessness was at an end. It was largely confined to older men in skid rows. One book at the time was entitled Old Men, Drunk and Sober. Researchers thought that when that generation passed, so would homelessness. But that's not what happened. Income inequality increased. Many low-cost housing units were replaced by luxury dwellings. Rental costs grew, and incomes at the bottom of the distribution did not keep up. Poverty was already high in the United States compared to other industrialized countries, particularly so for families, and poverty became deeper. Thus, the surplus of affordable units turned into a larger and larger deficit. In the 1980s, the New York Times ran an editorial series called New Calcutta. Wags complained with some justice that the Times was unfair to Calcutta, but the point of the metaphor was clear. How, the Times asked, could such abject poverty be permitted in a wealthy land? Over the 80s and 90s, people began to spend more and more of their income on rent. And when that did not suffice, they doubled up with family and friends. When those arrangements broke down, they took to shelters and the streets. Modern homelessness arose, first among younger men, racial minorities, women, and then families. This map shows what a full-time year-round earner's hourly wage would have to be in order to afford the fair market rent. That is, a rent at about the middle of the market for a 2-bedroom apartment. Affording here again means paying only 30% of one's income on housing. I'm lucky. I come from Tennessee, where one merely needs a full-time job paying $16.58 per hour to afford a 2-bedroom apartment. Wisconsin is similar. Some states are better, others are worse. But there isn't any state or county in the United States where a household with one full-time minimum wage earner would be able to afford the rent. And there are only a handful of counties where that full-time worker could afford a 1-bedroom apartment. Of course, statewide averages are oversimplification. Rents are different in Madison and, say, Eau Claire. This figure illustrates the relationship between housing costs and high rates of literal homelessness. It shows the largest 25 metro areas in the United States. The left axis is the rate of homelessness, the point in time count divided by the total population. The bottom axis is median rents. You can see a clear relationship here. Homelessness is higher in places with particularly high rents. Those metro areas tend to be affluent, but also have high rates of income inequality, and therefore many people who cannot afford the high rents. This is the final piece of evidence that homelessness is fundamentally a housing affordability crisis. A housing choice voucher is a rental subsidy that holds a family's housing costs to 30% of their income. A rigorous experimental study showed that providing those housing vouchers to poor families who were receiving welfare wiped out the risk of homelessness. I'll provide more evidence later about using vouchers to get families who are already homeless back into housing. How does social exclusion work to put some people at greater risk for homelessness than others? We have most evidence for African Americans, where 4 forms of social exclusion in incomes, wealth, housing, and incarceration seem particularly important. The first form of discrimination is in jobs and incomes. In 2018, Black men earned 3/4 as much as whites. Black women earn 4/5 as much. For the past 3 decades, unemployment has been roughly twice as high for Blacks. This is not a difference in skills and experience. A paired testing study had people with the same education and experience answer job ads, but use names identifiable as African American or not. The study measured differences by the person's apparent race in being called in for an interview. The difference between being Lakeisha and being Emily was the equivalent of an 8-year difference in experience. Wealth disparities are much starker than income disparities. The median white family has 13 times the assets of the median Black family. And even a Black household with a college degree has less wealth on average than a white household with less than a high school diploma. Because for poor people, most wealth is tied up in housing, Black families are more likely than white families to experience housing crises and less likely to have a relative or a friend able to provide housing help. These wealth disparities didn't just happen. They result from a long history of governmental as well as private discrimination. The federal government segregated public housing, with Black families shunted to inferior housing projects. The Federal Housing Administration refused to insure loans to Black homebuyers, or even whites in integrated areas where Blacks also lived. The color-coded maps used by the Federal Housing Administration to deny loans in so-called risky areas are the origin of the term redlining. Thus, Black families were unable to benefit from the accumulation of housing wealth following World War II that white families were able to pass on from generation to generation. Urban renewal often cleared out neighborhoods where Blacks lived, and highways cut through Black neighborhoods or cut them off from areas with better jobs. And paired tests that measure housing discrimination by sending similarly situated Black and white renters or buyers to visit the same housing units show that discrimination continues today, despite the fact that it has been illegal since the late 1960s. And then there are the disparities in rates of incarceration that were exacerbated by the so-called war on drugs, and the much greater likelihood that people of color would be incarcerated as a result of minor drug charges. Incarceration takes fathers out of families, and earners out of communities. Incomes are affected even after a person is released. People with disabilities have not just the challenges associated with their disabling conditions, but also face discrimination in the housing and job markets. And income benefits for people with disabilities are too low for affording housing. So those are the causes of homelessness: a housing affordability crisis that's particularly hard to cope with for people that also live with the results of social exclusion. Now let's turn to solutions, what we know works for resolving homelessness and preventing it. Here we have evidence about programs that work for particular groups and also about the impact of broader systems changes. Let's start with programs for families. The Family Options Study, which I conducted with Apt Associates, examined housing and service programs for homeless families. It was a true field experiment, not a demonstration program. We examined 148 programs in actual use in 12 communities around the country. The characteristics of the families in the study are similar to those of all sheltered homeless families in the United States. At the time they entered the study, they had incomes at about half the poverty level. Many showed signs of psychological distress, and about 2/3 had experienced a prior episode of homelessness. A little over a quarter had a spouse or partner with them in shelter, and 10% had a spouse or partner living elsewhere, often because of shelter rules. We examined the effects of 3 types of interventions 3 years after families entered homeless shelters. The first is a long-term housing subsidy, which we abbreviate as SUB, and you'll see that acronym in this next section of the talk. SUB consists of renewable housing subsidies provided primarily through HUD's Housing Choice Voucher program for housing in the private market. The theoretical rationale is that homelessness for families is a housing affordability problem, a problem that subsidies can fix. Community-based rapid rehousing, or CBRR, provides short-term rental assistance for housing in the private market. The idea is to get families back into conventional housing as swiftly as possible and with the lightest touch. Families got light services focused on housing and employment. Project-based transitional housing, or PBTH, provides time-limited housing and extensive social services in supervised facilities. The theoretical rationale is that families who experience homelessness have a variety of problems they need to address before they can succeed in housing. Families can stay up to 24 months. Both rapid rehousing and transitional housing provide temporary housing subsidies with 3 key differences. Rapid rehousing helped families rent ordinary community-based housing, whereas transitional housing was in supervised programs. Transitional housing had more extensive services, and it tended to last longer. We compared these 3 interventions to the usual care available in communities, or UC. Usual care consists of emergency shelter and housing or services that families access on their own without immediate referral to one of the 3 active interventions. Nevertheless, usual care families found their way into all of the other programs. A third had secured long-term subsidies 3 years after random assignment. To join the study, families had to have at least one child age 15 or younger, to have stayed in emergency shelter for 7 days or more, and to consent to participate. The study is an experiment, meaning that families were randomly assigned to interventions. However, many housing programs have requirements for entry, and we did not want to send families to programs that we knew would reject them. So how do you do an experiment in these circumstances? What we did is we screened families for eligibility for all the programs with open slots in their community. And then we randomized families to priority access to one of the interventions for which they'd passed the screening, or assigned them to usual care. For the experimental analysis, we compared everyone offered an intervention with the usual care families who passed the screening for that intervention but did not get any special offer. This preserved the integrity of the experiment. In a sense, we have 3 mini experiments, each with a slightly different control group, made up of those usual care families who are eligible for the intervention to which they are compared. This slide shows the sample for the study and information about the timeline. Families enrolled in the study from September 2010 to January 2012. We followed up 81% of them, an average of 20 months after random assignment, and 78%, an average of 37 months after random assignment. We're currently negotiating with HUD for an 11 or 12-year follow-up. To screen families, we asked questions that reflected the requirements of programs that had openings in their community at the time we recruited the family in shelters. Rapid rehousing and subsidy programs accepted most families, but transitional housing screened out more than a quarter. All families were eligible for usual care by definition. Families were not required to enroll in the assigned program. Rather, we gave families a referral to a program that had reserved an opening for them, and shelter personnel encouraged and supported them to pursue the referral. As is the case for any referral system, priority access gave families the freedom to pursue the assigned intervention or to seek any other kind of assistance on their own initiative. Families voted with their feet. Just over half of the families assigned to transitional housing after screening moved into their assigned program over the next 3 years. In some cases, programs did additional screening when families showed up, and we can't tell who made the decision, whether the family or the program. More families, 3/5, accepted rapid rehousing, and 88% of those given priority access to a housing subsidy passed any additional screening by the housing authority, found a willing landlord, and leased up.
Beth, we have a clarification question, or a quick one from Liz Duffy. How did you work with local coordinated entry systems and address equity for non-participant families who otherwise would have been prioritized for these housing interventions due to vulnerability?
Mm-hmm. So coordinated entry was not really in place in most of these communities at the time that we did the study. That's a more recent innovation. We brought the housing subsidies to the study and to the communities. That is, normally families who experience shelter don't have access to housing subsidies. And we were able to get HUD to sweet talk the housing authorities into providing roughly 50 housing subsidies in each of our communities. And so we were enriching the supply that was eligible we were enriching the supply of options for families. Families could opt into the study or not. Almost everybody opted in because we had housing subsidies as a potential offer. And then the programs agreed to random assignment, but families who got usual care, or the very few families who opted out of the study, could continue to get into these programs on their own, and they did. I'll show you that a little later about how people filtered into the various programs. Okay.
Thank you.
So this slide shows the take-up or use of the specified type of assistance over the full 3 years in the 3 impact comparisons. So not all families with priority access took up their assigned programs. Some used other programs of the same type, and some usual care families found their way to these types of programs even without the priority access. So the first 2 bars show the permanent subsidy versus usual care impact comparison. 88% of the families offered priority access to a permanent subsidy, and 38% of comparable usual care families leased up with some type of permanent housing subsidy during the 3-year follow-up period. The second set of bars shows the community-based rapid rehousing versus usual care impact comparison. 59% of the families offered priority access to rapid rehousing, and 23% of comparable usual care families used rapid rehousing assistance to rent an apartment. The third set of bars shows the project-based transitional housing versus usual care comparison. 53% of the families offered priority access to transitional housing, and 35% of the usual care families used transitional housing for some length of time. Thus, the use of the named intervention by the usual care control group was comparable in the 3 impact comparisons, but the high take-up by families offered permanent subsidies meant that the experimental contrast was strongest there. The study
Sorry, one more quick question there.
Yep, go for it.
Just very quick. Can you clarify, what does take up mean for usual care?
Take up means leasing up with a permanent subsidy, leasing up with a rapid rehousing subsidy, or moving in to transitional housing.
Thank you.
It means the same thing for the people who got priority access and for the usual care group. It's actual move in. Okay. The study examined impacts in 5 domains at 2 follow-up points, 20 months and 37 months after families entered shelter. The first outcome is housing stability. That includes homelessness and a range of residential outcomes. Next is family preservation. That refers to separations and reunifications of family members. The third domain is adult well-being, which included physical and psychological health, substance dependence, and intimate partner violence. Next, the study looked at various aspects of child well-being, focusing on school attendance, school mobility, development, and health. The final domain is self-sufficiency. It included employment, income, and food security. We also examined program costs. Let me give you an example of how the analyses worked. This slide shows housing stability outcomes after 3 years in the permanent subsidy versus usual care comparison. All analyses are on an intent to treat basis. These gray bars are the proportions in the usual care group with each one of these outcomes. 18% of usual care families reported being homeless in the last 6 months before the 3-year interview. 19% had experienced a shelter stay based largely on program administrative records for months 21 to 32, the last full year for which we have data on all families. And 28% reported doubling up, living with friends or family, because they could not find or afford a place of their own. The blue bars are the proportions among families offered housing subsidies for each of these outcomes. And the impacts are the differences between the blue and the gray bars. For the first outcome, at least 1 night homeless in the last 6 months, we see that priority access to a permanent housing subsidy lowers the proportion from 18% to 9%, an impact reduction of 9 percentage points. Because we considered outcomes if they were significant at the 0.1 level, 3 asterisks means significant at the 0.01 level. We can see that priority access to permanent housing subsidies reduced the proportion experiencing homelessness in the last 6 months by half, reduced the proportion with any shelter stay by nearly 3/4, and reduced experience of doubling up by more than half 3 years later. And these results are similar to impacts we saw at 20 months. Priority access to community-based rapid rehousing did not lead to changes in any of these measures of housing stability compared to usual care. This was true at 20 months as well. If there was an effect of rapid rehousing on housing stability, we missed it when we came back for the first time 20 months after randomization. And note that there's some rounding in all these numbers. Here we see that priority access to project-based transitional housing lowered shelter stays in months 21 to 32 relative to the usual care control group when some families were still in transitional housing. There's no effect of priority access to transitional housing on the proportions reporting homelessness in the last 6 months or doubling up in the last 6 months. At 20 months, when even more families were still in transitional housing, assignment to transitional housing resulted in a smaller proportion reporting homelessness in the last 6 months, as well as lower shelter use than usual care. At the 37-month point, we don't detect any effect on the self-report measure of homelessness. Rather than dragging you through all of the outcome domains, let me provide a summary. This chart shows the 16 pre-designated outcomes at each of 2 time points for each of the 3 interventions. Priority access to housing subsidies in the first 2 columns for 20 months and 37 months, rapid rehousing in the next 2 columns, and transitional housing in the last 2. The domains go down the side. A green box here designates a beneficial effect, a red box a detrimental effect, and a yellow box an effect neither clearly beneficial nor detrimental. Let's look at the patterns. At both time points, priority access to permanent housing subsidies caused striking improvements in housing stability relative to usual care. These benefits extended to all other outcome domains: fewer separations of children from parents, better adult and child well-being, better food security. The one negative red effect is a 6 percentage point decrease in employment at 20 months, with no significant effect on income. This employment effect was no longer significant at 37 months. The yellow box at 37 months is more separations of respondents from partners who had been with them in shelter at the outset. We judge this ambiguous because partner separations were associated with domestic violence, which was also reduced. So subsidies may have allowed some women to escape abusive relationships. Priority access to community-based rapid rehousing led to essentially equivalent effects to usual care for almost all of the outcomes examined. There was no positive effect that was replicated at both the 20-month and the 37-month follow-up points. Priority access to project-based transitional housing affected only housing stability, and only during the time when some families were in transitional housing. So now let's look at program costs. We did so in two ways. Here's the first: the cost of serving a typical family for a full month in each program type, averaged across the 148 programs in the study. There's a lot of variability within as well as across program types. Emergency shelter programs, shown on the right of the slide, had the highest per family monthly cost of about $4,800 per month. Next highest, transitional housing programs, cost an average of just over $2,700 a month. Rapid rehousing programs had the lowest per family monthly costs of just under $900 per month, and permanent subsidy programs cost on average just under $1,200 per family per month. These interventions had different typical lengths. For our sample of families, most families who received permanent subsidies were still receiving assistance at follow-up and had already received about 33 months of assistance. Rapid rehousing typically provided about 8 months of assistance, and transitional housing typically provided about 13 months. This is a second way of looking at costs: the total program costs for comparable families assigned to each condition. So this is equivalent, or this is the cost estimate for these impact comparisons. Each colored bar here shows the costs of all the programs that the families in each group used over 3 years. Surprisingly, the costs of program use by families assigned to each group varied much less. How can that be? So each colored segment of each bar shows the cost for a particular program type calculated by multiplying average cost per month by the average number of months families in that group use the program type. Across all the comparisons, the usual care families used housing and service interventions costing about $41,000 over 37 months. So usual care is far from nothing. The first pair of bars that I've highlighted shows the subsidy versus usual care comparison. The cost of subsidies, which is the purple, in the group offered subsidies was largely offset by the greater use of emergency shelter, the black bars, and transitional housing, gray, in the usual care group. Over 37 months, families offered subsidies using programs that cost about 9% more than comparable families in usual care. The second set of bars shows the priority access to rapid rehousing cost about 9% less than usual care, mostly because of the lower use of transitional housing, gray, by the families in the rapid rehousing group. The third set of bars shows families offered transitional housing cost slightly more than those offered usual care because of much greater use of transitional housing. So let me summarize all of this information program by program. Rapid rehousing subsidies, that is, time-limited subsidies to get families back into housing quickly, have become the approach HUD favors in the homeless service system. In our study, subsidies lasted 8 months on average, although HUD now allows them to last somewhat longer. Take-up of the program was low. Altogether, fewer than 3/5 of families offered rapid rehousing used it. Families were given referrals to specific programs that had reserved spaces for them, yet 2/5 did not show up. As one mom put it, Okay, we get out of shelter, find a place for who knows really how long, and then what? Wind up back in shelter? It seems kind of counterproductive to me. Although I appreciate the help, certainly, but ultimately it seems kind of failed in that aspect. Because if by the end of the year I don't have a way, where do we go from there? Everything seems to be closed. If there was an effect of rapid rehousing subsidies on housing stability, we missed it by the time we went back for our first follow-up at 20 months. And there were scattered effects on other outcomes consistent with chance. The main selling point for rapid rehousing is cost. It's certainly no worse than usual care, and it's cheaper. So on that ground should be preferred. But it doesn't do much to end homelessness. Until recently, transitional housing, where families live in supervised settings and receive extensive psychosocial services, was the mainstay of the homeless service system. But although the programs are designed to serve families experiencing homelessness, they screened out far more families than did the public housing authorities that administer housing vouchers. And take-up by families was low. Families could stay up to 24 months, so that transitional housing had small effects on use of homeless shelters during the period that some families were still in the transitional housing programs. But the offer of transitional housing did not affect doubling up. The theory behind transitional housing is that families need to address the problems that brought them to homelessness or that are consequences of the homeless experience with psychosocial services before they can flourish independently. This approach is sometimes called services first, in contrast to housing first. The family options study provided no evidence for this theory. There were no benefits of transitional housing for psychosocial outcomes, child welfare, or self-sufficiency. And the programs cost slightly more than usual care. Transitional housing may be of some benefit to groups that are really transitioning, such as youth aging out of foster care or people leaving correctional institutions. But we did not study these groups, and we found no evidence of benefits for families. The 12-site family options experiment provides strong evidence for the benefits of access to long-term housing subsidies. Offering families housing vouchers that reduced rental costs to 30% of their incomes not only reduced every measure of homelessness and residential instability, but also had radiating impacts. It reduced separation of children from their parents, children's school moves, absenteeism, and behavior problems. It reduced family food insecurity. For adults, it reduced domestic violence, psychological distress, and substance abuse. That is, vouchers reduced some of the individual problems that can sometimes lead to homelessness, and it provided a platform for families to solve other problems on their own. As one mom put it, for me to actually have a nice house for our children without having to be completely worried about rent for this month, because my husband is trying to go back to school full-time, and so am I. We know we're supported, and we don't have to worry about losing the house because we're trying to go to school and work, and we're safe, we're okay, and we'll get things back on track. Further, few families were ineligible for the vouchers, lease-up rates were high, and all these benefits cost only about 9% more than usual care in the communities we studied. And Black families were just as successful as white families in our study in using and retaining vouchers. The success of housing vouchers in ending homelessness provides additional support for the theory that homelessness is, at its core, a housing affordability problem. Vouchers alone end homelessness for most families. People with disabilities often need more help. Supportive housing, subsidized housing with services under people's control, ends homelessness for people with serious mental illness and substance abuse problems. The traditional approach here is sometimes called the staircase model, in which people earn their way to more independent housing by addressing behavioral health challenges. Like transitional housing, that doesn't do much for families, this traditional approach can be called services first. The housing first approach bypasses the steps in the staircase model and gives consumers immediate access to independent permanent housing without preconditions and with services they choose. There's strong experimental evidence that this approach works better than the old staircase model. The Pathways Housing First program was developed by Sam Tsimberis in New York City. In the model, consumers get housing of their choice with private landlords directly from the street. Housing First is not housing only. Wraparound services, including health, mental health, substance, vocational, and recreational services, are provided by multidisciplinary teams called assertive community treatment teams. But consumers have complete choice over what services to use. There are no requirements to participate, no brownie points either. And there are no requirements for sobriety or participation in treatment, to get an apartment or to stay there. This contrasts sharply with the Services First programs that predominated at the time Cimberis developed his program, an approach that remains common today. There, in the Services First program, outreach workers work with consumers to make them housing ready. Those who are clean and sober can come indoors to congregate settings and gradually earn their way to more independent housing based on sobriety and success in treatment. For many, that independent housing is a holy grail, never to be attained. Cimberis showed that his program had housing retention rates much higher than other programs funded by the same mental health funding stream. But the people who ran the other programs said, you can't possibly be dealing with the same people we have. Our people can never make it in independent housing. So it was time for an experiment. Cimberis had been a student at NYU, where I was on the faculty, so he recruited me to work with him on an RCT. That's Cimberis on the right in the picture. We recruited a sample of homeless people staying on the street. They had to have spent at least half of the past month on the street, not in shelter, and to have a homeless history of at least 6 months and a serious mental illness to make them eligible for the funding stream. In fact, our people met the criteria for chronic homelessness. They averaged over 6 years of homelessness and 5 psychiatric hospitalizations. There was a subsample of people recruited from psychiatric hospitals who met the study criteria immediately before entering the hospital. We randomly assigned 225 people to the Pathways model or to Services First with differential assignment based on program capacity, and we retained 91% for 12 months. This graph shows the housing trajectories people followed, specifically the percentage of time they spent homeless in each of the first 12 months of the study, months down on the bottom axis. The Pathways program had the goal of getting people into ordinary housing. The control programs had the goal of getting them into appropriate housing, but both had the goal of ending literal homelessness. And so we graph literal homelessness and we cluster analyze these trajectories. There was a quick group that got into housing or housing programs in the first couple of weeks and stayed there. A median group took a little longer, but got off the streets between months 1 and month 5. A slow group took longer to get indoors and didn't necessarily stay there. An in and out group got off the streets, but then became homeless again. And a never group basically never came indoors. There was also an outlier group that I can't graph. They had at least 2 ins and outs in the first year, but their patterns don't line up with each other to form a cluster. These trajectories differed enormously by experimental treatment. 3/4 of the Pathways group got into housing within the first couple of weeks and stayed there. That was true of 43% of the control group too. All forms of supportive housing work for many people, but some are not willing to put up with the restrictions of Services First programs. Over 90% of people assigned to Pathways got into normal housing within the first 5 months, whereas 22% of the control group essentially never made it into housing, and another quarter came in slowly or got in and then left again. Along the way, we convinced a lot of skeptics. A few months into the study, recruitment was lagging, so we invited a group of outreach workers to breakfast at NYU. One outreach worker ate our bagels, but argued that it would not be ethical to refer the clients that she worked with to the study. They might get randomly assigned to receive their own apartment, and that, she insisted, would be setting them up for failure. A couple of weeks later, we caught a break. A study participant who'd been randomly assigned to the Pathways to Housing program invited his family and his former outreach worker over to dinner to show off his new apartment. The outreach worker was so impressed by the transformation of this devil denizen of the streets into a gracious host that he told all the other workers at his agency. They responded by referring dozens of clients to the study. We finished up recruitment and randomization with a bang. Of course, the outreach worker's epiphany could have been based on an anomalous case, And you never want to make policy on the basis of one small experiment in which the program developer is the PI. For a long time, although the program spread, there was little other rigorous data. But then a Canadian RCT called At Home Chez Soi really nailed it. This was a multi-site study with over 2,000 participants with mental illnesses, stratified by level of need. In the Housing First group, high needs people got the original multidisciplinary assertive community treatment teams, and a moderate need group got case management. Both groups were compared to usual care, which prioritized services over housing. The At Home Chez Soi team replicated the initial findings of the Pathways to Housing study, with much better housing retention in both the Housing First groups. By now, Housing First has gathered such acclaim that everyone claims to be doing it, no matter how little their programs resemble the evidence-based practice. Some embarrassing colleagues have responded by developing a fidelity scale. And the At Home Chez Soi study and other studies have shown that programs with better fidelity to the model get better results. So we know how to end homelessness if we devote the resources. The US cut veteran homelessness nearly in half with the combined efforts of the Veterans Administration, the Department of Housing and Urban Development, and state and local governments. Veterans were targeted with special supportive housing vouchers, following the Housing First approach, and with other rental subsidies. The VA screened veterans who came in for medical services for risk of homelessness, and cities put veterans at the head of their lists for housing. The US also reduced chronic homelessness by increasing the supply and targeting of permanent supportive housing. When we put our minds to it and add resources, it makes a difference. Families and non-vets have not been the focus of these coordinated national efforts. Other countries have done better. Finland has largely ended literal homelessness with a concerted Housing First approach. Note that the light blue bars, institutional placements, would not even be counted in US figures. The dark purple bars at the top are families. So few families are homeless in Finland that the official statistics don't break out the different forms of homelessness. And for families, doubling up is included here. Finland has not met its goal of ending doubled up homelessness as well. And that is the target of the next phase of its efforts. So there's strong evidence that we can end homelessness for people who experience it. But we also need to prevent homelessness for people on the brink and to stop generating homelessness. Prevention programs are difficult to design well because it's hard to tell who would have become homeless in the absence of the intervention. Getting services to the people who will benefit most is a major challenge. It's not enough for a provider to say, 90% of the people who got my program remained housed. I can tell you how to get to 100%. Just give your services to millionaires. So bad targeting can masquerade as effective prevention programming. Every study that has looked finds that you get the most impact by focusing on people with the highest needs, even if you also have the most failures there. I'll illustrate that. New York City has a prevention program called Home Base, which consists essentially of good old-fashioned social work backed up by some cash resources. Workers make sure that families are signed up for all the benefits they're entitled to. They can try to mediate problems with landlords or primary tenants with whom a family is living. They can offer help with education or job placement or financial counseling. And they can provide short-term financial assistance. The program is funded by the city and delivered by nonprofits rooted in their communities. There's experimental and quasi-experimental evidence that it works, modestly. But as with when anything of potential value is on offer, more people are likely to apply than there are funds to serve. For the first few years, workers interviewed applicants, and then they decided on their own whom to serve. The city then provided me with that intake data and actual shelter entries over the next 3 years for 11,000 families. We used Cox proportional hazard analysis to develop a risk model that the city continues to use to decide whom to serve. The next question was whether services should go to households at highest risk or whether some households were too risky to serve. In the latter case, a model of triage, as adopted by doctors on the battlefield, would reserve services for people in the middle. If triage was the right model, there would be some families at low risk who were unlikely to go to shelter, and others at such high risk that they would enter shelters no matter what was done. Here's the data, and they provide no evidence for triage. The bottom axis shows the relative risk of shelter entry with families divided into 10 equal groups. The left axis shows the proportion of families who entered shelter in each group. The top dashed line shows shelter entry at each level of risk for families whom workers left to their own devices declined to serve. The bottom solid line shows shelter entry for families workers deemed eligible for services. The difference between these lines is one measure of impact. There was indeed a low-risk group unlikely to go to shelter whether or not they received services, almost half of the sample. But there were no families too risky to serve. Impact was greatest where risk was highest, even though the failure rate was also highest for the highest risk households. The help on offer here was much less extensive than ongoing rental subsidies, so that the program impacts were smaller. But even this fairly inexpensive program made the most difference for people at highest risk. As we will see, that finding is consistent across every prevention study that is looked. Why did workers deem some high-risk families ineligible for services? It turned out that in comparison to the model based on the data, workers erred in giving services to people who might be called the worthy poor. They were more likely to give services to high school graduates, but people who had not graduated from high school were at higher risk. They were more likely to give services to people who were employed, but people who were unemployed were at higher risk. In targeting prevention services, we need to decide whether we want to reward worthiness or to end homelessness. Let me summarize the strong evidence that a few prevention strategies work. As I noted earlier, there's experimental evidence that the same housing vouchers that end homelessness also prevent it for poor families. The highest risk families, those where the household head was unemployed and those whose public assistance was about to run out, benefited most. In the case of New York City's home-based program, we just saw that families at highest risk benefited most. The last program with strong evidence of success is cash help for eviction prevention. Most people who are threatened with eviction do not go on to become literally homeless. In one rigorous study in Chicago, it was about 2% over the next 6 months. But as that study showed, cash help reduced the percentage much further. Like most programs to help families faced with eviction, the Chicago program required people to be worthy. Families had to show that their financial crunch stemmed from an eligible crisis, such as job loss or a medical emergency, rather than from enduring poverty. And they had to show that they'd be able to sustain the rent once the crisis had passed. So services did not go to the highest risk families, but among the families served, effects were strongest for the poorest families, those with incomes below 90% of the poverty line. Very few people with higher incomes became homeless, whether they got help or not. There's weaker evidence for some additional approaches. Legal help reduces eviction, but we don't also know that it reduces homelessness. Ongoing rental subsidies smaller than those provided by housing choice vouchers prevented homelessness among people with HIV in one study. Shallow ongoing subsidies haven't been studied for families, only short-term subsidies of the sort provided by rapid rehousing programs. And universal screening for prevention was part of the full court press that reduced homelessness for veterans. There are a number of other prevention programs, both for families and for other groups, that may well work, but we don't have enough research to know for sure. This is a fruitful area for additional research. In addition to helping people on the brink of homelessness, we need to change the broader societal conditions that are the causes of homelessness. I showed earlier that most homelessness is temporary. Although we have strong evidence on how to end it for people who experience it, and we have some evidence about how to prevent it for people at high risk, we will never put an end to homelessness unless we stop generating it. And we have pretty good ideas about how to do that. Because housing affordability depends on the gap between housing costs and incomes, anything that reduces housing costs or raises incomes at the bottom of the distribution will help. We also need to combat social exclusion. Let's talk first about reducing housing costs. The most powerful thing we can do, the closest thing we have to a silver bullet to end family homelessness, is to expand the housing choice voucher program. The program has expanded only from 2 million to 2.2 million households in the last 20 years. Thus, only about a quarter of households who are eligible for vouchers receive them, and waiting lists are long or even closed in most jurisdictions. Adding about 300,000 units a year nationally and focusing on the poorest renters would both prevent and end homelessness. The Bipartisan Policy Center estimated that a scaled-up program of that magnitude to provide vouchers to all eligible households that would use them would cost about $31 billion per year. Some areas of the country also need to work on expanding the supply of rental housing. And that can be done by expanding the National Housing Trust, along with local efforts like affordable housing funds. But if we want to end homelessness, it's important to focus on the poorest renters, those with incomes below 30% of local area median. That's approximately equivalent to poverty with variation from place to place. But many affordable housing funds extend to households at 60% or even 120% of area median. People with those higher incomes may still be struggling, but they aren't likely to become homeless. We need to produce cheaper housing too, such as co-housing models, essentially a modern version of single-room occupancy hotels with shared amenities, or by using modular construction. And we need to overturn exclusionary zoning that raises costs. For example, by reducing barriers to producing multifamily housing and reducing barriers to subdividing existing housing units. The housing affordability gap can also be closed by increasing incomes and strengthening the income side of the safety net. Most of you know more here than I do. Strategies include raising the minimum wage, enhancing the earned income tax credit, making it more generous to childless adults. The Temporary Aid to Needy Families program provides families with time-limited income, but many families who are eligible are not enrolled. SNAP, also known as food stamps, reduces costs that compete with rent. Child allowances are on the table in Washington. SSI and SSDI disability income could be raised to levels that make housing affordable or require only a small rent subsidy to make housing affordable for people with disabilities. In the Family Option Study, among the third of families who reported a disabled member, those who secured disability benefits were more likely to stay housed. More widely available low-cost childcare would reduce a major barrier to working for families at risk of homelessness. And childcare and paid family leave might keep infants and preschool children out of shelters. Income volatility is also an issue. We've all seen the effects of income loss in the current COVID crisis. Augmenting unemployment insurance, getting it to people quickly would help. Expanding Medicaid in states that have not done so would reduce the role of health crises and income volatility. The housing and income strategies trade off with one another. For example, if incomes are increased sufficiently, then fewer housing vouchers will be needed. But the gap is large enough that we probably need an all-of-the-above approach. Raising incomes and reducing housing costs would go a long way towards preventing homelessness by closing the housing affordability gap. But we also need to work directly on social exclusion. We have evidence that housing choice vouchers work better, that is, more people succeed in using them to find housing units in places that prohibit landlords from refusing to rent to a household simply because that household will be using a voucher to pay part of the rent. An increasing number of states and cities are enacting such laws, but it would be good to have a national law. It took HUD 50 years and a Black president to issue a rule to enforce the requirements of the 1968 Civil Rights Law that communities create a plan to identify and dismantle barriers to fair housing on the basis of race, disability, and other categories. And the Trump administration quickly put that new rule on hold. We need better enforcement of the national fair housing laws that are already on the books. We do a much better job of monitoring ongoing illegal discrimination than of enforcing the law. In sum, we know how to end homelessness. We know what causes it. We know how to help people leave it. We know a lot about how to prevent it. What it takes is political will. Homelessness is a choice, not by people living on the street, but by the rest of us when we turn the other way. If you're interested in reading the research behind the arguments I've made here, my colleague Jill Kaduri and I have summarized it in a recent book called In the Midst of Plenty, Homelessness and What to Do About It. Our central message, as in this talk, is that we know how to end homelessness, and our country has the resources to do it. Finland is not as wealthy as the United States, but they've chosen to end homelessness. We could as well. So I'd welcome your questions and thoughts.
Thank you so much, Beth. We have a number of great questions that have come up in the Q&A, and please continue to do that. And I apologize, there are two kind of clarifying ones going back to the family option study that I'd like to start with. I apologize, I got kicked out of the Zoom for a minute when they came up. But Karen Holden wants to know, are the impacts in that study unique, or can they overlap for the same person? And I think that's what the in looking at like nights in shelter and those types of outcomes.
So each outcome is measured independently on an intent to treat basis for the entire group. So somebody could both have been in shelter and be doubled up over the past 6 months by self-report.
Great. And Karen, let us know if that does not answer your question or have more. And then another clarifying question from Jeff Smith about that same study. What fraction of the usual care group used any of the 3 types of intervention?
This is program use over 32 months for the usual care group. And you can see that at the start, they, showed up in emergency shelter. By about 6 months, they were kind of evenly spread between transitional housing, rapid rehousing, and any permanent housing subsidy. As time went on, they used more permanent housing subsidies, and by the end of the 3-year period, over a third of them were in a permanent housing subsidy situation. Some were still in transitional housing. Others were typically back in emergency shelter. They didn't stay in emergency shelter the whole time.
Great. We have a couple of questions from Kurt Paulson, who one of our great faculty members working on housing issues. For those offered a voucher who met the screening criteria of the PHA, how many were unable to lease up in the time allowed because they weren't able to find a willing landlord? And does this rate differ from metro area to metro area?
So we had much higher lease-up rates than in any prior study of housing vouchers. Our families were more desperate, and they didn't always find the housing of their dreams, but they leased up. Most studies of housing choice vouchers go to people who are already in housing, and if they don't find a housing unit within the time allotted, well, they're still in some place. So over the 3 years, it was 88%. That includes a few people who were in public housing in the Hawaii site, but it was, I think within the first period when they had to lease up within their first 3 months, I believe it was 74% in our sample that got into housing with the housing choice voucher.
Terrific. A couple related questions. This is from Kieran Furlong. I'm interested in how much of a barrier security deposits are to getting into rental accommodation for people doubling up or homeless.
They are certainly a barrier. We asked people about housing barriers in the study, and lack of money for rent, lack of money for security deposits, lack of a credit history were the big barriers. Eviction history for some people, but that was not as big a barrier as just lacking the money for the upfront costs.
Okay. Good. Another question from Matt Kinsella Walsh. From a historical perspective, how does the rise of American homelessness, in particular unsheltered homelessness, align with the defunding and privatization of public housing? Have any studies been completed, whether in the US or internationally, comparing the efficacy of affordable housing vouchers versus a robust public housing system in reducing homelessness?
So the US has kind of switched from the Reagan period onward towards funding housing choice vouchers rather than public housing for two reasons. One is to deconcentrate poverty. That is, if you put families in, or you allow households to rent throughout an area, you hope that you will have less concentrated poverty than if you have public housing projects. The other is that housing choice vouchers are cheaper. So manufacturing, building housing is more expensive than simply using vouchers. And so vouchers have become the kind of preferred mechanism in the United States. Historically, homelessness has risen and fallen with economic cycles. So the last time we had families who were homeless was in the Great Depression, and there were Hoovervilles of folks living out of doors, including families. And then, you know, in the 60s, we really thought that homelessness was at an end. And then it rose again in a sense with rising income inequality and the increasing share of income taken by housing. Is that responsive to the question? Oh, internationally, we are a leader in homelessness, as in incarceration and in so many other social ills. Other countries are following in our footsteps. So Europe and Australia have increasing housing kinds of crises. They are more likely as a group to use kind of social housing rather than a voucher approach. But I think the big difference, the reason we got the jump on them is the level of income inequality in the United States, the poverty and the depth of poverty that we experience.
Thank you. We have 3 questions left, and they're all great, kind of big questions, but I hope we can get to all of them. So one is, it's clear that the subsidies are the best possible intervention to end family homelessness based on the studies. How can you address 2 barriers to achieve this outcome? Number 1, lack of available rental homes, and number 2, landlords that don't accept the voucher. Mm-hmm.
Well, for number 2, landlords that don't accept the voucher, source of income discrimination works. Source of income discrimination laws work. So those are laws that prohibit landlords from not renting on the basis of the way that a person is going to pay their rent. And they're often used to sort of mask racial discrimination. So I think we have shown, there's a nice Urban Institute study that shows that jurisdictions that have source of income discrimination legislation give families an easier time, households an easier time of leasing up. And the first part of that question I have forgotten. I'm sorry, would you repeat it?
That's okay, sure. The first part, let me just find it here. Lack of available rental homes.
Okay, so that really depends on the area of the country that you're talking about. And on the West Coast, we really need more housing production. On the East Coast, it looks like outside of some cities, the vouchers would really do the trick. And where we need housing production, we need that. And I think the tools there, that's a longer term prospect, unfortunately. The tools there are permitting more types of housing. Not everybody needs, a 3-bedroom house with 2 bathrooms and a white picket fence on half an acre. We really need to think about multiple kinds of housing. We need to think about subdividing existing units. We need to bring back essentially single room occupancy dwellings. They don't have to be miserable. They could be well managed by nonprofits if they're funded adequately. And so we need more types of housing. We need modular construction. We may need manufactured housing. Those are trailers, essentially. So I think we do need to be producing housing. The National Housing Trust Fund is one way to do that. Low-income housing tax credits are another way, though they tend not to produce housing that is affordable to the folks I care about. They need to be paired with housing vouchers to make them affordable for people at the bottom. But on the West Coast and in some cities elsewhere, we are going to have to work on increasing the supply. Other places, the supply is there and the issue is affordability.
So another question, again from Kurt Paulson. As you know, Congress passed $25 billion in emergency rental assistance that will soon be delivered. How would your research inform local policy decisions about how to allocate and prioritize these funds?
Give them to the poorest people with the longest history of problems. That is, there's a tendency to try to give those rental subsidies only to people who can show that their rental problems are due to COVID, that they're short-term, that they'll be back in the game as soon as they get a little bit of help. And I think every study shows that you give your resources to the people who are worst off to have the greatest impact.
A question from Steve Cook. You stated at the beginning that the primary reason for the homelessness epidemic is the shortage of affordable housing. How do you suggest government policy balance direct assistance to those with housing needs against policies to incentivize increases in affordable housing supply?
Well, it's sort of the same question that I just tried to answer. In most places, efforts to make housing affordable will suffice. There are places, particularly places that are geographically constrained and along the West Coast, where we're going to have to focus on supply as well. And the difference is local. I mean, one thought is that federal funds for producing housing should require some kind of local match so that areas that really have a shortage will be happy to come up with that match, and areas that don't have a shortage won't, and that will help us allocate the housing to the places that need it most. Right now, the allocation doesn't go to the neediest areas necessarily. It's population based and it's politically based, and everybody gets to have a piece of it, rather than the subsidies for increasing the housing stock going to the areas with the biggest shortage.
Thank you. I think we have time for one more. Your arguments and evidence for the housing first model are quite powerful. Are there conversations about the impact of quality of housing environment provided under such models on retention and resident well-being?
Mm-hmm. I think the most important variable is people's choice. So if people feel that they've chosen a housing unit, they're more likely to stay there. But quality of housing matters, and there are, in the housing first, the Pathways Housing First model, it's scatter site housing, it's housing with private landlords. There are supported housing programs that are programs, and some of them are lovely. Some of them are, very nicely built kinds of places, but they do concentrate poverty, and they are, you are residing in a homeless program as opposed to the community. I'm sure quality of housing matters, but I think choice of housing probably matters even more.
Well, Beth, on behalf of IRP, I just want to thank you so much for joining us and for this terrific presentation. Just a lot of audience engagement. I'm sorry we couldn't talk for longer. I just want to remind everyone, we hope you can join us next week, February 18th, when we'll welcome our National Poverty Fellow, Amelie Hecht, who will discuss strategies to increase access to universal free school meals. And thank you again, Beth, for a terrific seminar, and everybody for your questions. Have a great rest of your day.
Thanks so much for having me.